Hey guys, as many of you know, when patients get really sick with COVID, we often have trouble maintaining their oxygen levels, and in some cases, all we can really offer to save their lives is a lung transplant. So there have been a number of lung transplants done for COVID disease in the last couple of years, and we now have a study recently that is looking at outcomes in patients who had transplant for COVID disease. So a lot of these patients had severe pneumonia with what's called acute respiratory distress syndrome. Other patients had gotten through that acute respiratory distress syndrome and developed a lot of scarring in their lungs, which can also happen after COVID disease. And the study is looking at about 270 patients who got lung transplants for COVID, and it's telling us that they are generally younger than other lung transplant recipients, but they are also generally sicker. They are more likely to be on what's called ECMO, or a heart-lung bypass machine. They were more likely to be in the ICU and on ventilators. But the good news is that their overall survival was similar to other patients who didn't have COVID all the way out to 6 months post-transplant.